Hi, my name is Dr. Deborah Setter. Welcome to my Peripheral Neuroanatomy course. This video covers the intermediate neuroanatomy of the arm. Here, I'll go over the neuroanatomy you need to know for interpreting electromyography and nerve conduction studies, as well as take your neurological exam to the next level. Let's get started.
All right, now we're at the intermediate level. Let's draw out our brachial plexus with a little more detail. We're going to start with that fishbone again. Draw that V and a line, line and a V, V and a line. Then our sideways W and add in our X and the half of the Y. So this is the basic fishbone from the foundational level. We have our nerve roots, C5, C6, C7, C8, and T1. Off this C5 nerve root, let's add our little dorsal scapular nerve. We remember our marmu. For the radial nerve, we're going to add a split here, and for the median, we're also going to add a split. Let's add some labels. So this little nerve, this is our dorsal scapular nerve. Our nerve roots are going to come together to form the trunks of the brachial plexus, the upper, middle, and lower trunks. Then those trunks are going to divide. So this is called the divisions. The upper trunk divides, the middle trunk has its divisions, and here's the lower trunk with its divisions. Those divisions, when they come together, form the cords. There's the lateral, posterior, and medial cords. These are so named based on their relationship to the axillary artery. So if this is a cross-section of an arm, this in the center, that's the axillary artery. For reference, this would be the patient's head, there's their nose. So this is the dorsal aspect, this is the ventral aspect of the patient. Dorsal, ventral, medial, lateral. We see that this is where those cords come in. The medial cord is on the medial aspect of the axillary artery, medial. Then the posterior cord, and then over here would be the lateral cord. So that's why the cords are named the way they are. Then the cords divide into the terminal nerve branches. We have our musculocutaneous nerve, axillary nerve, our radial nerve, which is going to divide into its superficial sensory branch, and the posterior interosseous nerve. The median nerve is going to divide into the anterior interosseous nerve, as well as continue forward, just median part too. And then our ulnar nerve. Let's add in the muscles. The dorsal scapular nerve innervates the rhomboids. The musculocutaneous nerve innervates the biceps. Axillary nerve innervates the deltoids. The radial nerve, this proximal portion, innervates the triceps, brachioradialis, and the extensor carpi radialis. The posterior interosseous nerve will then innervate the extensor carpi ulnaris, extensor digitorum communis, and the extensor indicis proprius. The median nerve, the proximal portion, innervates the pronator teres and the flexor carpi radialis. The anterior interosseous nerve innervates the flexor digitorum profundus to the second and third digits, as well as the flexor pollicis longus. and then continues forward. The median portion continues forward and innervates the abductor pollicis brevis, the opponens, and the lumbricals for the second and third digits. The ulnar nerve will innervate the flexor carpi ulnaris, the flexor digitorum profundus for the fourth and fifth digits, the lumbricals for the fourth and fifth digits, the interossei for EMG, especially remembering that's our FDI, our first dorsal interossei, and the abductor digiti minimi. There we go. There's our diagram of the brachial plexus.
All right, we've drawn out the brachial plexus. Now let's organize this information into a table. This portion of the talk is a little dry, so I encourage you to take handwritten notes. Handwriting helps with remembering information. When we've completed the table, reorganize the information in the way that makes the most sense to you. Last, download this PowerPoint and use it to quiz yourself. All right, here's the diagram of the brachial plexus. I'll be highlighting the nerve root, trunk, cord, and final nerve to give you a visual to help with remembering this information. I have my table organized by muscle, root, trunk, cord, and nerve, and all the information at this level, I have it grouped by the nerve. All right, let's get started. So the first muscle is going to be the rhomboids muscle. The rhomboids is the C5 nerve root to the dorsal scapular nerve. On my table, there's also a little bit of C4 if you want to be precise, but it's primarily a C5 muscle. That's why I'd have it underlined there. Next is the deltoid muscle. The deltoid is C5 and 6 nerve roots, upper trunk, posterior cord, axillary nerve. Primarily a C5 muscle. That's why I have it underlined. Next is the biceps muscle. The biceps, C5 and 6, upper trunk, lateral cord, musculocutaneous nerve. Triceps muscle, C6, 7, 8, upper, middle, lower trunks, posterior cord, radial nerve. Brachioradialis. Brachioradialis is C5 and 6 nerve roots, upper trunk, posterior cord, radial nerve. Brachioradialis is primarily C6. Oh, the triceps primarily is C7. Extensor carpi radialis. C5, 6, and 7 nerve roots, upper and middle trunk, posterior cord, radial nerve. Primarily C6. Extensor carpi ulnaris. C7 and 8, middle and lower trunks, posterior cord, radial nerve, posterior interosseous nerve branch. Primarily a C7 muscle. Extensor digitorum communis. C7 and 8 nerve roots, middle and lower trunk, posterior cord, radial nerve, posterior interosseous nerve branch. Primarily a C7 muscle. Extensor indicis. C7 and 8 nerve roots, middle and lower trunks, posterior cord, radial nerve, posterior interosseous nerve branch. Primarily a C8 muscle. Pronator teres. C6 and 7, upper and middle trunks, lateral cord, median nerve. flexor carpi radialis, C6 and 7 nerve roots, upper and middle trunks, lateral cord, median nerve. Flexor digitorum profundus for the second and third digits, C8, T1, lower trunk, medial cord, median nerve, anterior interosseous nerve branch. Primarily a C8 muscle. Flexor pollicis longus, C8, T1, lower trunk, medial cord, median nerve, anterior interosseous nerve. Also primarily C8. Abductor pollicis brevis, C8, T1, lower trunk, medial cord, median nerve. Opponens pollicis, C8, T1, lower trunk, medial cord, median nerve, primarily T1. Lumbricals for the second and third digit, C8, T1, lower trunk, medial cord, median nerve. Also primarily T1. Flexor carpi ulnaris, C8, T1, lower trunk, medial cord, ulnar nerve. Primarily T1. Flexor digitorum profundus for the fourth and the fifth digits, C8, T1, lower trunk, medial cord, ulnar nerve. Primarily C8. Interossei, palmar aspect, C8, T1, lower trunk, medial cord, ulnar nerve. Primarily T1. Interossei, the dorsal interossei, primarily thinking of the FDI, the first dorsal interossei, is really important for our EMG examination. C8, T1, lower trunk, medial cord, ulnar nerve. Primarily T1. Lumbricals for the fourth and fifth digit, C8, T1, lower trunk, medial cord, ulnar nerve. Primarily T1. Abductor digiti minimi, C8, T1, lower trunk, medial cord, ulnar nerve. And there we have it. This is the table summarizing all this neuroanatomy that we've just learned. Again, I have mine grouped by nerve, so you can see there's the radial and the posterior interosseous nerve branches, same for median, same for ulnar. This helps keep this information organized. Again, feel free to reorient this in the way that makes the most sense for you and just keep practicing. All right, now let's see this in the context of a neuromuscular exam.
All right, so again, we've drawn out that brachial plexus, organized that information into a table. Let's see it again in the context of a neuromuscular exam. Thank you to Dr. Hannah Zhao-Fleming for assisting with today's demonstration. In the spirit of thinking of all the muscles that are important for EMG, we're going to start with the dorsal scapular nerve. So the rhomboid muscles are here, and these are useful because it's that dorsal scapular nerve right off that C5 nerve root. For testing the rhomboid, you have the patient wrap their arm around their back and then push against your hand like this. So go ahead and push. That lift-off motion of the arm off the back activates those rhomboids. Go ahead and do that again. So that's the rhomboid C5 nerve root dorsal scapular nerve. All right, let's go ahead and rotate back around. We're at the intermediate level, so before I encouraged you guys to practice naming the muscle, the nerve root, now let's think of the entire path of the nerve, starting from the root, trunk, cord, nerve. All right, so starting again with the deltoids muscle, this is our C5 and 6 nerve root, upper trunk, posterior cord, axillary nerve. Go ahead and relax. Next is the biceps muscle. One important thing for testing the biceps is you want to make sure that the hand is fully supinated. Remember holding that bowl of soup? For the biceps muscle, go ahead and pull again. Remembering that this is C5-6 nerve root, upper trunk, lateral cord, musculocutaneous nerve. Next is going to be that brachioradialis muscle. For the brachioradialis, you want to make sure that that arm is midway between pronation and supination. This is how you test that brachioradialis. Go ahead and pull up. Brachioradialis, this is C5-6 nerve root, upper trunk, posterior cord, radial nerve. Next is the triceps muscle. This is C6-7-8, upper, middle, and lower trunk, posterior cord, radial nerve. All right, next are the wrist extensors. The wrist extensors, you're going to have the extensor carpi radialis and extensor carpi ulnaris. You can try to pick these out a little bit by asking the patient to tilt their wrist radially or ulnar. And then, if they're twisted ulnar, you can apply pressure more to the radial side of the hand or the ulnar side of the hand. In general, though, they tend to work together, so it's not a definitive bedside test, but important for EMG. The trick for remembering the extensor carpi radialis and the extensor carpi ulnaris, these are both radially innervated. This is C5, 6, 7, 7, 8. That's how I remember it, just tracing the arm, 5, 6, 7, 7, 8. So those are going to be for the extensor carpi radialis. That's 5, 6, 7. That's the upper and middle trunks, posterior cord, radial nerve. This is 7, 8. That's the middle and lower trunk, posterior cord, radial nerve, and it's going to be that posterior interosseous nerve branch. Now for the wrist flexors. For my bedside exam, I'll have them extend their arm and flex at the wrist and pull like this. It's a team of muscles. It's the flexor carpi radialis and flexor carpi ulnaris. Sometimes I can apply a little extra pressure radially or ulnar-wise to help differentiate between those muscles, but in general they work together as a team. Now for EMG, when we're examining these muscles, flexor carpi radialis, this is the median nerve, C6-7 nerve root. This is the flexor carpi ulnaris, C8-T1. So to go over that whole path, it's C6-7, upper and middle trunk, lateral cord, median nerve. For the flexor carpi ulnaris, that's C8-T1, lower trunk, medial cord, ulnar nerve. And again, if I have someone on the EMG table, I can have their arm fully outstretched. Bend at the wrist, and then pick out radial or ulnar. So that's the wrist flexors. Next, we'll test the pronator teres. So for this, you grab onto the forearm like this and ask the patient to turn turn it inwards. Good. That's how you test the pronator teres. This is also C6-7, upper and middle trunk, lateral cord, median nerve. That's the pronator teres. Next, we're going to test the finger extensors. So keeping them flat, there's a team of muscles again working on finger extensors. There's the extensor digitorum communis as well as the extensor indicis proprius. So if I'm testing the extensor digitorum communis, again, you just support the hand and apply pressure here. This is C7-8, middle and lower trunk, posterior cord, radial nerve, posterior interosseous nerve branch. It's the same innervation for the extensor indicis proprius, so if their hand's flat and they're just lifting up, just lifting up that second digit, you can see there's the tendon for that muscle, and one of the trick for EMG, yep, relax it and lift it up, relax, lift it up. I can even see it starting to activate in her. So that's the extensor indicis proprius. It's the same innervation as the extensor digitorum communis, the C7-8 middle and lower trunks, posterior cord, radial nerve. Those are the finger extensors. Flipping it over here, these are the finger flexors. Remembering again, this is the median portion and this is the ulnar portion. This is actually the anterior interosseous nerve branch of the median nerve. And I like to remember here, this is C7-8, this is C8-T1. So this is the flexor digitorum profundus, the median innervated component, and the flexor digitorum profundus, the ulnar innervated component. Remembering again, this is C7-8, C8-T1. Those are the flexors. Next, let's test the finger spread again. Remembering this is the interossei. Our first dorsal interossei is going to be really important for the EMG. One of the ways to optimize testing the intrinsic hand muscles is to have them put their hand flat on their lap or flat on a table. You can even hold onto these fingers and ask them to push this finger against mine. That's isolating that first dorsal interosseous muscle. I can do the same for the abductor digiti minimi, holding onto the muscles here, yep, and push against me. Both the interossei and the abductor digiti minimi, these are C8-T1, lower trunk, medial cord, ulnar nerve. Next, testing the thumb muscles. So again, going to that abductor pollicis brevis, having the hand flat and popping it up to the ceiling. This is median nerve. This is C8-T1, lower trunk, medial cord, median nerve. Next, we'll test the opponent's pollicis. So you ask your patient to take their thumb, touch the base of their fifth digit. That's the opponent's muscle. The opponent's muscle, this is also C8-T1, lower trunk, medial cord, median nerve. That's the opponent's. Another intrinsic hand muscle to test are the lumbricals. The lumbricals are a little bit tricky. What you want to do is you want to lift up the finger like this and isolate this MCP joint. The lumbricals are responsible for finger extension across here. Yep, exactly. So go ahead and push up that finger. These are the lumbrical muscles. Remembering that the second and third digits, these are median innervated. These are the ulnar innervated lumbrical muscles. They're all C8-T1, lower trunk, medial cord.